Hello everyone, you're watching sqadia.com. Today, our topic is injuries to the pelvis, and I am Hammad Haider. We will have three sections. The first section, we will have the pelvic fracture assessment. We'll be briefly discussing the surgical anatomy, its clinical assessment, how to assess whether it's associated with pelvic fractures or not, especially in the case of a polytrauma patient. What are the imaging modalities we need to do? What are the different types of x-rays we need to get, whether we need to get CT and MRI or not, especially what is the role of CT in the case of pelvic fractures. And lastly, associated the imaging of urinary tract. Why it is important? Because as you know, pelvis is actually, there are multiple other organs as well which is present in the pelvis. Especially these are associated with urethral as well as the bladder injuries. So urinary tract imaging is always almost associated with the pelvic fracture assessment. Then in the second section, we'll be going through the isolated pelvic ring fractures. We will be briefly, as we would have discussed by then, the anatomy of the pelvic ring. Then we'll be discussing the fractures of it, whether what are the fractures which are associated with the pelvic ring, what is Young-Burgess classification, what is Stahl classification of the pelvic ring fractures, and what are in Young-Burgess you have two types of fractures, that is anterior posterior compression, lateral compression fractures, or there's a third type is called as a vertical shear fracture. We'll be briefly discussing the Stahl and Young-Burgess classification in the second section. In the third section, we'll be going through the acetabular fractures. It may be an isolated acetabular fractures. Acetabular fracture may be associated with the pelvic disruption as well. We'll be discussing the judicial and lateral classification of the acetabular fractures. Actually, the judicial and lateral classification involves two basic types of fracture classification. One is the elementary fracture classification, which involves either the type of wall or the column fractures, and there may be associated in which maybe more than one wall or one column may be involved, and there may be hemitransverse fractures as well. Lastly, we'll be discussing the pelvic discontinuity, that is the injury to sacrum and the coccyx as well. What is important is when we'll be discussing the acetabular fracture, we'll briefly discussing upon the two very important concepts of it, that is what is anterior column and anterior wall, and what is posterior column and posterior wall. Thank you very much. Keep watching sqadia.com.